Good morning. This morning, we will be discussing a gynecological problem which is very common amongst women, especially the African woman. We'll be talking about fibroids this morning very quickly. What is a fibroid? Also called myoma or leiomyoma. Fibroid is a growth of the muscle of the womb, which means it is an abnormal growth of the muscles of the womb. The womb, where the baby stays in, is majorly composed of muscles. So an abnormal growth of this muscle is what we call a fibroid. How common are fibroids? Fibroids are very common amongst women of the reproductive age. That is between 15 to 49 years. Very common amongst them. In actual fact, 20 to 50% of women in the reproductive age will have fibroids. So we can see it is very, very common. And majority of fibroids, as we know it, are benign, meaning that they do not cause cancers or are not cancerous. But a very few amount, less than 1% of fibroids are what? Are cancerous. So it's very, very important that after any fibroid surgery, such fibroids that were removed from the womb are taken to the lab for histology, such that one is able to pick the ones that are not benign. But very rarely will that happen. So more often than not, most fibroids are benign growths, not cancerous. Most times, patients will ask, "Doctor, what causes fibroids?" Because they are so worried. Is it what they are eating? Sometimes that is the misconception they have. "Doctor, is it what I'm eating that has caused this fibroid for me? Is it what I'm drinking?" But the truth of the matter is this: we do not know what causes fibroids. However, there are risk factors to the development of fibroids, and one of them is a genetic predisposition, such that when we see it in an auntie, in a mother, so one starts to look at the child who is a female, that maybe the child may have fibroid, so a genetic disposition to having fibroids. Also, obesity has a link with fibroids, and also the African race do have a propensity to developing fibroids. In actual fact, the fibroids amongst the African women are bigger, larger, huge than what we see in a Caucasian. So in actual fact, we do not know what causes it, but these are some of the risk factors. So where are the areas that fibroids can be located? As I told you, fibroids are a benign growth, abnormal benign growth of the muscles of the womb. So where can these fibroids be located? One, it can be located inside of the womb, which is called a submucous fibroid. Two, which is most common, can be located within the muscles of the womb, called an intramural fibroid. And thirdly, it can be located on the surface of the womb, called a subserous fibroids. There are other locations, but these are the most common locations. And I stand to say that the intramural fibroids, that is within the muscles of the womb, are the most common fibroids, the most common locations that we have. And the locations of these fibroids would have a bearing on the symptoms of fibroids. The most common symptom a woman will have with fibroids is what? Abnormal menstrual bleeding. Her bleeding will be heavier. Maybe she was bleeding 3 to 5 days before, but now it will increase to about 7 to 10 days, even much more than that, with some blood clots. Pain during the menses. She may also have pressure symptoms because a big mass is in her pelvis. So we would expect that there will be pressure on the bladder so that the woman will be going to urinate often. She may even urinate and feel she has not completely emptied her bladder. She may also have pressure symptoms when going to defecate. She may have constipation. The pressure symptoms could also affect the kidney. So these are some of the symptoms a patient will come with, including abdominal swelling, where people will be greeting you and thinking that you're expecting a baby on the way. And they will greet you and say, oh, yeah, madam, oh, are you expecting twins? Which sometimes could be an embarrassment to the patients. These are some of the symptoms. A common question patients will now ask is, doctor, can my fibroid make me infertile? Can my fibroid prevent me from getting pregnant? The answer is, usually a fibroid will not cause infertility. Usually. However, it may play a role. One, if the fibroid is within the womb, a submucous fibroid, it could do what? It could prevent the embryo from implanting in the womb after the woman has conceived, and it could also lead to recurrent miscarriages. Also, if the fibroid is blocking the cervix or blocking the fallopian tube, then it won't allow the sperm to go and meet the egg. That may also cause infertility. In actual fact, if I have looked at all the causes of infertility and I cannot find none, and I operate on a woman with fibroid, 70% of the time the woman will come back pregnant. With fibroids, there are treatment options for us. So it's best to see your gynecologist so that he discusses with you the treatment options for these fibroids. We have both medical treatments and surgical treatment for the fibroids. The medical treatments are used in the temporary to reduce the sizes of these fibroids pending when the woman will be operated. That is because when we stop the medical treatment, the fibroids grow back. Okay, so we will not just use the medical treatment continuously. When you have the surgical treatment, which is what's called a myomectomy, where you have to remove the fibroids. And after removal of the fibroids, it's usually advocated for women that once the fibroid is removed, we want to try as much as possible to get pregnant within 1 to 2 years. Right? Because we do know that once we remove a fibroid, 5 to 7 years down the line, a fibroid may regrow. So it's imperative that the woman tries as much as possible to get pregnant if she has not completed her family life. And main reasons why women want to operate a fibroid would be the size of the fibroid, she's bleeding excessively, the pain and pressure, or she's just having recurrent pregnancy losses. There may be reasons why a woman may need to be operated. So please, there are no herbal remedies to the management of fibroids. Some women have suffered. They will tell you that, oh, they will flush out the fibroid, putting some things into the vagina of the woman. Fibroid is a physical problem, and it needs a physical removal of that growth and then send for histology to be sure if it's not cancerous. So please see your gynecologist if you have an abdominal swelling, where a scan will be done for you and determined the size of the fibroid, the location of the fibroids. Thank you so much.